It's Rachel Butt in New York. I'm the distressed debt editor for 9fin, and here today we have Samantha Kroontje, distressed debt reporter, with us. Welcome, Samantha.
Thank you for having me.
So, Samantha, you put out a pretty extensive story on Prospect Medical, and it is really engaging, and I would love to know, how do you come up with this idea? Like, what prompted you to look into this company? Because stress is everywhere, but...
I think a lot of credit goes to one of our legal analysts, Zana Scarlett. She was covering the Prospect bankruptcy and brought it up at some of the team meetings. So I had been seeing a lot of reports and webinars popping up about private equity, the problems of it moving into healthcare. So I started looking into Prospect and the closures in Pennsylvania. And after that, thought it would be a good subject to talk about the larger issue of private equity sometimes having goals that are at odds with healthcare systems.
Mm-hmm. Yeah, that's definitely a great topic. And just backing up a little bit, can you tell us more about Prospect Medical? What does it do? And how did it get to this point?
Prospect Medical, it's a large healthcare company. It started out when private equity owner Leonard Green took it over in 2010. It had 5 hospitals. And after that, after it was bought out, it started acquiring a ton more, mostly through incurring debt. So it's a hospital provider all over it. When it filed for bankruptcy, I think it had 16 hospitals in the U.S. Mm-hmm. And then 4 were in Delaware County in Pennsylvania. And those are the 4 that shut down. So healthcare company, and then shut down mainly through the debt that was incurred to fund acquisitions, then fund dividends to its owners.
Mm-hmm. Right. And has it been impacted by the pandemic as well?
The pandemic, that I think the company was struggling for a lot of reasons. Like they had supply chain issues. They couldn't pay their vendors. They were having problems during COVID. Mm-hmm. But it seems like a lot of the finances, the troubles started in 2010 when they were doing all of these acquisitions, paying out. I think it was over $550 million in dividends over the 11-year Leonard Green ownership period. So that was a big problem, was just being so over-levered and then having these maturity walls come up. So they had over $1 billion in term loan debt to pay off. And that's when they did a sale leaseback transaction with the REIT Medical Properties Trust. Mm-hmm. So sold out 20 at the time hospitals to MPT, which allowed them to pay off their debt, but then stuck its hospitals with a ton of lease obligations. So over $100 million, and then $34 million just to the Crozier, the Pennsylvania system. So there were definitely like broader environmental, like macro issues, but I think just being too levered led to that sale leaseback transaction and then a subsequent new money LME in 2023, which ultimately didn't solve its problems and then filed for bankruptcy in January.
Speaking of Crozier, is this part of Prospect? And if so, where is it primarily operating in? What kind of communities do they serve? And can you tell us more about that?
Yeah, so Crozier Health is a healthcare system in Pennsylvania. It operated 4 hospitals in Delaware County, which is just west of Philadelphia. And it's a pretty rural, pretty socioeconomically struggling area. Its capital city is Chester, and there's also a lot of gun violence there. So a big need for hospitals and good healthcare access. And it also owns somewhere upwards of 100 primary healthcare facilities, outpatient facilities. So that was one of many healthcare systems that Prospect bought. It bought it back in 2016. And then Crozier ended up having to close its hospitals, mainly due to those overwhelming lease obligations it had to pay off.
Right. And you actually made it to Delaware County, right? And saw a lot of the facilities and talked to some people who worked or have ties with the hospital system and patients as well. What was it like over there? And how would you describe people's sentiment when you talk to them, and how are the facilities?
Well, one of the things that I thought was, I thought it was really worthwhile to go in person. Of course, like I could set up interviews beforehand, but I think when you actually go to where something's happening, you meet people that you don't expect to meet. And one of the times that happened was when I went to Christina Perrone. She's was a landlord of Crosier before it broke its lease.
Mm-hmm.
So I went to her primary healthcare facility, which is really lovely, but completely emptied out and left with a bunch of like garbage and scrap paper from when Crosier cleared it out.
Mm.
So she was giving me a tour. We were up on the second floor, just around some of the doctor's offices. And this older man had wandered in, found us, and said he was a retired firefighter, didn't know what had happened. He was looking for his doctor, trying to figure out what happened. And then just 20 minutes later, we were doing an interview, Christina Perrone and I, in the lobby area. And this older woman walked in, and the story goes a little bit into how the area is socioeconomically struggling,
mm-hmm.
and older and a bit more poor. And she fit that description. So she came in looking for her doctor, kept thinking that Christina Perrone could help, but the only thing she could do, obviously, was take down these people's contact information
Mm-hmm.
and pass it along to somebody that she thought could help. But I thought it showcased some of the other issues because, even like who could she pass that information along to if you're not really mobile, if you don't have a car, like there's not another health system that's nearby that can help you. You would think that a lot of people in the area would have known what happened, like it was a huge story, but even looking at Census Bureau data, a lot of people don't have computers and didn't know really what was going on. So she was the conclusion of the story. And I think while it was sad to meet people like that, of course, it was definitely worthwhile to meet some of those people and go into the hospitals that are still open around the area and see what was going on.
Right. So it sounds like patients were surprised by this news. And what about employees who's been working for Crosier? Like, were they notified ahead of time? Did they know this was coming?
A lot of people were surprisingly out of the loop that I talked to. The healthcare workers that I talked to that were in the story, they were more involved in the union, so they were following the bankruptcy more closely. But I think the average person, the average nurse or doctor, isn't going through bankruptcy filings, and it wasn't in the news too much until Prospect had requested to close its hospitals. So I think a lot of people were surprised. Consistently, people were saying that they got a 10-day notice, which is crazy short. 10 days. And then suddenly I think everybody was meeting outside of one of the hospitals, trying to figure out what to do and what was going on. And I visited a couple weeks after the closure. So when I talked to healthcare workers, they were still trying to find new jobs, didn't really know where to go. There were suddenly thousands of people that were unemployed and all highly skilled. But obviously there's no infrastructure to take on those people. So I think a lot of people moved away. Went to neighboring health systems, UPenn, that sort of thing. But at the time that I went, everybody was still kind of reeling and getting their head around that they lost their job in less than 2 weeks, which is crazy.
Yeah, that's terrible. Because effectively the closure of Prospect created this healthcare desert, right?
Yeah, in Delaware County, so there's 2 hospitals left. 2 hospitals with emergency rooms are left over where there were 6 before. And now Prospect is abandoning 2 of its hospitals. So one of them is getting sold to a school district because it's right beside a high school. And there's already been 2 incidences of high school students breaking in. So they're going to buy it and demolish it. One of the others has a buyer, but they haven't disclosed any information about that. But it doesn't really look like anybody's coming in to take over the hospitals, and they'll remain empty for the foreseeable future.
Yeah, that's heartbreaking, especially when we're talking about a community that's so dependent on their access to critical care. And as I understand it, Prospect is also dedicated to serve a lot of patients on Medicare and Medicaid. Is that right?
Yeah, most of their revenues for a long time came from Medicare and Medicaid. And they operated, a lot of their hospitals were in what they called underserved communities.
Right. It surely won't be any easier with what the Trump administration has proposed to make huge spending cuts. Right.
Yeah, for sure. Yeah, that's a big challenge. There are a lot of people that are working to help solve some of these problems. I got to talk to Pennsylvania State Senator Tim Kearney and then a state representative, Lisa Borowski, and they co-authored this bill. It's kind of like most states have antitrust legislation that gives attorneys general and departments of health oversight over private equity firms who are operating healthcare companies to make sure that, give them the green light on the transactions they're pulling off to make sure it's in the best interest of the community. So Tim Kearney and Lisa Borowski co-authored this bill and applied. It got passed in Pennsylvania earlier this summer. So that's good because it'll keep something like this from happening in the future, but obviously can't undo the damage that was already done.
Right.
But yeah, certainly big problems coming from the top with the Trump administration bill. But I think on a positive note, at least there are people closer to the ground that are working on solving some of the issues with for-profit healthcare and private equity getting so involved now.
Right. I can't tell you how many private equity-backed healthcare companies where we have covered that have seen a lot of financial issues and unraveled. And if we can dig a little deeper, how has Leonard Green's involvement contributed to Prospects' situation? And I guess what are the conflicting forces in play?
Yeah, some of the conflicting forces are obviously private equity, by definition being private, can be a problem in itself because then, the financial decisions and transactions that are being made are opaque and the communities that they serve and policymakers don't really have a say in what's going on. So that's a problem. Also, I think that private equity firms in general have short investment horizons. They want to they can overhaul operations really quickly, try to increase revenues really quickly. And sometimes that can lead to asset stripping or cost cutting and things that are generally against the interests of patient care. If you're cost cutting, that oftentimes means staffing issues, that sort of thing. So with Leonard Green, it was, acquiring a lot of hospitals and consolidating health systems really fast, the debt-funded dividends, and then the sale leaseback transaction, which was in effect asset stripping.
Yeah. We certainly were able to get a lot of good financial details, right, from a report that you obtained.
Yeah, there was a lot of, between the bankruptcy and lawsuits, there was a lot of public information. The Pennsylvania Attorney General filed a lawsuit against Prospect. So that had some of the financials, it had the asset purchase agreement. And then the Senate Budget Committee did a year-long investigation into Prospect. So through them, there were thousands of pages of documents like board minutes and financials, all that was released. And they created a really comprehensive, really readable report that outlined pretty much all of the important transactions that went on. So that made it a lot easier to report because it was kind of like hints of where to look for the reporting.
Yeah, I'm glad. During your reporting process or writing process, anything that came out and surprised you?
I think it was surprising that the closures and all of the transactions that led up to it could happen legally in the first place because, a lot of, like I said, a lot of states do have antitrust laws in place that are protecting against that, and Pennsylvania didn't have one. Now, as of a month ago, I think it does. So that can't happen going forward. But yeah, it was surprising that a private equity company can have so much leeway and so much free range over something like an essential service like a healthcare company.
Right. Yeah. And because of what happened to Prospect, and I think a lot of other companies that are struggled, there's more scrutiny
For sure.
on their private equity role in this space. And just thinking back on your experience going to Pennsylvania and crunching all these numbers and pages of documents and talking to people, what would you say is the most challenging aspect
of the reporting process? Obviously, one of the challenges is that it is a sad topic to cover, and we cover bankruptcy and distressed companies all the time, which isn't the most optimistic on a normal day. But I think it's hard when it's an essential service like healthcare. And this story obviously went into the more like the human impact side of things. So harder seeing like the actual real consequences of some of these bankruptcies and some of the companies we cover.
Right.
Yeah. Sorry.
No, I was going to say it could be easy to get lost in that process of just getting the numbers right or the terms correct and forget about how all these figures actually have human costs. So
yeah, that too.
Yeah. Well, check out Samantha's story. It's publicly available on our Insights page, and give it a read. And thank you so much for tuning in, and thank you for your time, Samantha.
Thanks so much.